Hey, it's your freaking favorite medical channel, Medicosis Perfectionalis, where medicine just makes perfect sense. Today we have another update about the coronavirus. If you want to help people, tell them the truth. If you want to help yourself, tell them what they want to hear. Preach. On February 2nd, 2020, the condition looked like this, with the total number of deaths about 305 and the total recovered is 443. This was scary because the total number recovered was very close to the total death. The ratio was about 1 to 1. However, on March 2nd, 2020, just before I recorded this video, this is the number. Total deaths, 3,044. Total recovered, 45,000. So, you are at least 13 times more likely to recover than to die from the dadgum coronavirus. So in today's video, we'll have an update onto my previous video. We'll talk about corona, why do we call it corona? We'll have some statistics, and we'll talk about risk factors, what are the symptoms, complications, and the cause of death from the corona, some myths and questions and answers, and tips to protect yourself. I'm gonna bust some myths today, but your mama is gonna bust your gluteal region if you lie to her. On January 16, 2020, I made a video about JC virus, received 947 views. On January 24th, I made a video about coronavirus, received about 2 million views. So yeah, people are scared. Apparently, no one gives a hoot about JC virus right now. Even though it can cause progressive multifocal leukoencephalopathy, it can damage your cerebellum and make you wander around the field trying to find the fiends. Both JC virus and coronavirus can affect you if your immunity is weak. It was my first video to reach 1 million until The new name of the virus is SARS-CoV-2. SARS is severe acute respiratory syndrome, and this is coronavirus 2. But how about COVID-19? COVID-19 is the name of the disease, not the name of the virus. Too much headline reading, too little freaking learning. As you know, microbes are bacteria, fungi, viruses, or parasites. Corona is a freaking virus. Then we dig deeper. Science is all about digging deeper and being more specific. We divide viruses into DNA and RNA. Corona is an RNA virus. So why do we call it corona? Because in Latin, corona means crown. That's why the name of my channel is Medicosis Perfectionalis. Medicosis is Greek, Perfectionalis is Latin, because we get the lingo. For instance, we have Corona Radiata. There is Corona Radiata in the solar eclipse. Oh yeah, I know the solar eclipse. It's when the sun comes in between. Shut up. It's when the moon comes between the sun and the earth. And this is the sun, which is the Corona Radiata, and here is the moon. So this is the surface of the moon, and what you see around it is the sun. And it shows like this in a beautiful Corona Radiata. This is what the solar eclipse is all about. The ovum, when the ovum leaves the ovary and goes to the fimbriae of the fallopian tube, and then it ends up in the uterus. When it leaves this ovary, it looks like this, with a surrounding corona radiata. Beautiful. There is corona radiata in your brain. Like, look at this crown. It's just amazing, from Detroit down to Houston. And last but not least, there is your coronary artery surrounding your heart like a crown. Isn't that lovely? It is lovely until it gets blocked. Then it's painful. And even Corona beer, because the logo of the company is a crown. But don't worry, Corona beer has nothing to do with the coronavirus. Oh wait, what? CBS News, because of the coronavirus, 38% of beer drinking Americans now say they want order a Corona. Same thing happens on CNN Business, like two words that don't come together. But honestly, I don't believe that. Why? First, it's a survey. It's not a meta-analysis or a randomized double-blinded clinical trial. Also, the sample size is only small, and it's not done by Harvard or Johns Hopkins. It's by a PR firm. The only PR I care about is per rectum, #medical school. But then, HuffPost said no. 38% of Americans probably did not stop drinking Corona because of the coronavirus. Thank you, HuffPost, for stating out the obvious. So why do we call coronavirus coronavirus? Because it looks like a crown under electron microscopy. How about the shape of the virus under light microscopy? Shut up, doofus. We cannot see a virus by light microscopy. We need an electron microscope. Corona, baby. Science is all about being specific. Is it a bacteria, virus, fungus, or a parasite? It's a freaking virus. Is it DNA or RNA? It's RNA. Which RNA? Is it Toga, Flavia, Retro, Corona, Delta? It's Corona, baby. Okay, which type of Corona variety? Is it Alpha, Beta, Gamma, or Delta? It's Beta. Origin? Probably bats. Source and spread? Probably from an animal reservoir, bats, in China. And then it transferred from animals to humans, and then from humans to humans. When I made my stupid video on January 24th and compared between those and risk of death to you, some people argued, okay, heart disease is not infectious, but corona is. Of course, that's true, but I was talking about the risk to your life. You know what? Fair enough. Let's compare apples to apples. A virus to another virus. Fair? Fair. Okay. Estimated numbers of death from 29th of December 2019 to the 1st of March 2020. From freaking influenza, 105,000 deaths. From COVID-19, about 3,039. Ratio, this is about 100 to 3. If you do the math, it's 33 to 1. For every patient who dies from COVID-19, 33 patients die from influenza. Let's take it to the next level. Let's compare the estimated number of deaths in the last 200 freaking years from the entire family of the orthomyxoviridae, which include influenza, and the coronaviridae, which include the SARS, the MERS, and COVID-19. We divide influenza into influenza A, B, and C. No one gives a rip about B and C. They are way milder and less common than influenza A. Let's talk about influenza A. I want to talk about pandemics. Let's talk about 1889 Russian flu, 1 million deaths. 1918 Spanish flu, 50 million deaths, approximately. 1957 Asian flu, a million. 1968 Hong Kong flu, slightly less than a million. The Russian flu, we have no idea. Hashtag Soviet Union. 2009 flu pandemic, 200,000. Every year, the seasonal flu from 340 million to 1 billion collective. So you're saying that in 2019, 1 billion... No, that's collectively. That's 2019 plus 2018 plus 2017 plus 2016 until the earliest that we could count. Now let's talk about coronaviridae, baby. SARS, 800 deaths. MERS, about 860. COVID-19, 3,044 and counting. Do you still think that we are all doomed and humanity is toast? Oh, that's impressive, Medicosis. So why is there so much misinformation out there? The reason why so many people misunderstand so many things is not that these issues are complex, but people do not want a factual or analytical explanation that leaves them emotionally unsatisfied. They want villains to hate and heroes to cheer, and they don't want explanations that don't give them that. Touchdown, baby. I mean, on my previous video about the coronavirus, some people said that I was paid by the Chinese government. Give me a break. Let me tell you a personal story. Once upon a time, I was in the bathroom, stimulating my parasympathetic nervous system and relaxing my sphincters, both the anatomical and the physiological ones, and reading a book about statistics. And I learned the concept of stratified sampling. In other words, we need to dig deeper, no pun intended, and we need to zoom in. Science is all about being more specific. Example, imagine that we are sitting in Target Incorporated corporate office, and here is the CEO and the chairman of the board, or the CMO, Chief Marketing Officer, and they are asking themselves, who are our target customers who bring most sales? Okay, people, really is that gum helpful, man? So insightful. Be specific. 18 to 45 years old, they bring the most sales. Great. Men or women? Mostly women. Great. Single or married? Mostly married. Especially those with a new baby. Baby shower, baby clothes, baby whatever. They buy lots of stuff. How can we target them using advertising? And as the Zucks once famously said, Senator, we run ads. So it's not enough to just say people. We need to be more specific until you find your target audience. And then Target became very good at this. For instance, there was a story about a 17 or 18-year-old girl. She was pregnant. Target knew that she was pregnant before her daddy knows. What the F? How did they know? She goes to Target every time and she swipes her Target card. She has a specific Target card linked to her profile, which is known by a corporate. They realize that she goes to the store and every time she buys a larger size clothes, larger size pants, size 16 and then 17 and then 18, 19, next time 20. Why would a young girl who is 17 or 18 years old buy a larger size every time? A, pregnancy, or B, ascites, or C, fibroids. Most probably pregnancy. So she's pregnant. Let's send her ads about, oh, you want to buy some baby clothes? You want to buy this unique baby shampoo? Get ready for the baby, blah, blah, blah. And then her dad saw the ads in the mail, became very angry, kicked the Target door, and I want to speak to the manager of this crappy store. Oh, sir, what's going on? You are sending my young daughter ads about what subliminal message are you trying to tell her? Are you trying to tell her to get pregnant? I'm so sorry, sir. It must be a mistake. I'm so sorry. And then 4 months later, she gave birth to a beautiful baby, and daddy was wrong, Target was correct. Senator, we run ads. It's all about stratified sampling, baby. Now let's talk about the Pareto principle. In brief, 80% of the effects come from 20% of causes. You might say, oh, you are equally likely to be sued in any country. That's not true. More than 80% of lawsuits in the world take place in North America, specifically the United States. Another example, the world's gross domestic product is $86 trillion in 2018. You might say, oh, this GDP has to be like equally distributed and every country is equally contributing its share of the GDP. If you believe that, you are as naive as the B lymphocyte before it recognizes the antigen. When you dig deeper and zoom in and be more specific, you'll realize that only 5 countries produce more than 50% of the world's GDP, and the remaining 175 countries or whatever produce the other half. And then you dig even deeper. Are these 5 equal? No, the United States is more. So it's like 1/4 of the world's GDP comes from the United States. And then you dig deeper. You might find like only 5 states out of 50 states produce the vast majority of the GDP in this country. Science is all about being specific. Myth number 1, every person has the same risk of dying from heart disease as any other person. That's just a bunch of bilge water. The truth is, most fatalities of heart disease are men, usually older, and with multiple risk factors, including but not limited to diabetes, hypertension, cigarette smoking, hyperlipidemia, and family history of premature coronary artery disease. Myth number 2, every person has the same risk of dying from COVID-19 as any other person. If you believe that, you are as naive as the T lymphocytes before they become memory T. Most fatalities of COVID-19 are men, usually older, with pre-existing comorbid conditions such as cardiovascular disease, diabetes, COPD, hypertension, and cancer. Okay, medicosis, should I be worried? It depends. #risk stratification. First case, a healthy 21-year-old lady who lives in Jericho, Vermont, USA. She doesn't have any symptoms. She has no sick contact. Vital signs are completely normal. There are 0 cases of COVID-19 in Vermont until the 2nd. Should she get tested for coronavirus? No. Should I be quarantined for 2 weeks here in the hospital, doctor? No. But I still want to get tested. No, there are 330 million people in this country and 7.8 billion people around the world who want to get tested. But we don't have enough kits to test everyone, nor is there any evidence that this will be helpful. So what should I do now, doctor? Wash your hands, keep a safe distance away from people who are sick, and enjoy your life. Case number 2, this is totally different. 87-year-old male who is from Daegu, South Korea. I'm sure I mispronounced this. I'm sorry. High fever, cough, severe shortness of breath. Oh, by the way, doctor, my wife died from COVID-19 3 days ago. Sir, we can send an ambulance to get you to the hospital. Do you see the difference between the 2 cases? Oh, I just want to buy a house that's going to go up in value. It's location, location, location. But in coronavirus, it's location, risk factors, and symptoms. Shut up, medicosis. Just let me know how do I get up-to-date information. This tool by Johns Hopkins is amazing. Link in the description. It's an interactive map, and then you can go to your country, see the total deaths and the total recovered. Complications of COVID-19 include viral pneumonia, ARDS, mechanical ventilation, and even death. If you want to learn more about pneumonia, check out my pneumonia video in my playlist called Pulmonology. Another great tool is a website called Worldometer, and it gives you the total cases in linear and logarithmic fashion. As you see here, yeah, they are going up, but they are kind of flattening. The rate is not increasing as it used to be. Again, we cannot predict the future. It might shoot up next. We have no idea. On the same lovely website, you can see daily new case. Oh my goodness, the quarantine system is broke. Shut up, they just changed the diagnostic criteria on that day. Instead of the nucleic acid test, the PCR test, they used the CT scan. Oh, like what will cause a positive PCR test for corona? Only one choice, only one possibility, the dadgum COVID-19. Okay, what will cause the findings of viral pneumonia on CT scan? More than 100 different diagnoses, including but not limited to coronavirus pneumonia, influenza pneumonia, farmer's lung, bird fancier's lung, chemical worker's lung, miller's lung, byssinosis, asbestosis, silicosis, berylliosis, even coffee maker's lung. And you can see here the number of active cases, recovered and discharged, the number of serious and critical cases, the outcome of cases, recovery versus death. As you see here, you're more likely to recover than to die from it, like way more likely. So let's dig deeper. JAMA Network did a study about the number of cases in China, and they realized out of 44,000 cases infected, 81% of cases were mild, so calm down, 14% were severe, and 5% were critical. So what was the outcome? No deaths were reported in the mild cases, no deaths were reported in the severe cases, only the critical cases. And the case fatality rate in the critical cases was 49%, which is way higher than the overall case fatality rate. 70 to 90 years old had a case fatality rate of 8%, 80 years old or older, 15%. In Hubei province, of course, because this was the center, 2.9. Outside of it, 0.4% case fatality rate. There were no deaths in patients 9 years or younger. Just tell me, what should I do? If you don't have any symptoms, do this. If you have respiratory symptoms, you call your doctor first before going to the hospital, and then the doctor will tell you, stay home or go to the hospital. If you have been formally diagnosed with COVID-19, if you are severely ill, they are probably keeping you in the hospital. If you're mildly ill, they are probably releasing you to go home. Of course, it depends on the situation. If you have mild COVID, you should do this. There are some beautiful illustrated tips on the World Health Organization website: how to wash your hands, how to not be a walking amoeba, how to practice food safety. Let's bust some myths. Can ultraviolet disinfection lamp kill the new coronavirus? You have been marketed to death. Shut up. How effective are thermal scanners? Thermal scanners might detect fever, but as you know, you can have a coronavirus without fever. Also, you can have fever because like a bazillion causes, not including the corona. So no, like get a thermometer, it's cheaper. Can spraying alcohol or chlorine all over my body kill the new coronavirus? Shut up. So I've ordered a package from China. Is it safe? Yes, it is. I'm still worried. You can clean it with wipes and then wash your hands and then enjoy your new pair of boxer briefs. Can pets at home spread the new coronavirus? Probably not. Do vaccines against pneumonia protect me against the new coronavirus? No, vaccines against pneumonia will protect you against the pneumococci. Like the name has the answer, only against streptococcus pneumonia. Like same thing with the influenza virus, it will only protect you against the influenza virus, but not the COVID-19. So you're saying that these vaccines are useless? No, I'm not saying that. They have their place, but you're asking about the corona, so no. Should I get the flu shot? Yes, to protect yourself against influenza, which is more risky than the corona. Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? No, please tell your grandma to stop giving medical advice. Can eating garlic help prevent infection with the new coronavirus? Hashtag organic life, hashtag vegan. Stop it. No. Suppose that the genie appeared to me and said to me, you have been cursed by a coronavirus. Which one would you choose? MERS, SARS, or SARS-2, which is COVID-19? Personally, I will choose COVID-19. And I say, but how come medicals aren't you like listening to the news? Chill your butt down. Whenever you get any disease, like any disease, the fate is one of three things. You either recover or you die, or you become chronic. For these doofuses, the coronaviruses, there is no chronicity. You either recover or you die. This is called the case fatality rate. So when I say the case fatality rate is about 2%, translation, 98% is the recovery rate. Bingo! So if you calculate the case fatality rate for these three, for MERS it was greater than 30%, for SARS it was 11%, for COVID-19 is 2%. That's why I'll choose COVID-19 in a second. Because ideas are everywhere, knowledge is rare. Be cautious, not scared. Be alert, not anxious. Be analytical, not hysterical. For my lovely students who would like to know more about infections, check out my antibiotics course. We'll talk about how to treat bacteria, viruses, including medications for HIV virus, fungi, and parasites. The course is available on my website. Also, if you want to learn about cardiac pharmacology, check out my course on my website. There's a free sample. And you can get a 50% discount toward my cardio pharmacology course. Since this video will be demonetized, please consider supporting my channel on Patreon or PayPal. If you have any question, send me here. If you want to buy my courses, go to my website. Thank you so much for watching. As always, be safe, stay happy, and study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.